I have always been a sun lover, was a frequent tanning spa visitor, laid out in the sun, grew up, the pool, the lake here in St. Louis, and did the baby oil, did the Australian gold, and anything you could think of to get your skin bronzer, pretty much did that. This past October, I was on a girls' trip and I had gotten a little sunburn on my face, and it kind of just looked like a sun blister, like a little sunburn that never went away. And at Christmas time, it still hadn't healed. So I asked a friend who is a medical professional, and she was like, yeah, I'd probably get that looked at sooner rather than later. They, did a test on it and did a biopsy, and it came back that I would need the Mohs surgery.
Most of these come from sunburns that you have growing up. And it's a place that she did say that she'd gotten several sunburns in her lifetime. A lot of the damage actually happens in our childhood and in our teens and 20s, and then several years later down the road. Sometimes you'll notice a bump or a little sore or some kind of just small abnormality like she did, and then it can go on to slowly grow. So for any basal cell carcinoma on the face or neck, Mohs surgery is indicated for several reasons, one of which is that it can have a root system that goes a little bit wider and a little bit further on the face. And so for her, and especially in an area like the nose where it's prime real estate, not only do we want to make sure we get all the cancer out, but we want to do it with the smallest safety margin possible.
I was very laid back about it. I wasn't nervous. I always felt that I was in good hands, very professional, very knowledgeable staff. So I went in for the surgery, and, Mohs surgery, you don't actually know how long you're going to be there because they take different layers, and so it could be a couple hours or not. And really, I just went with it, prayed a lot, and hoped, for the best. And they did get it in one layer, so that was good. I was shocked to see how thick that one layer was. It was about a dime-size hole in my nose, like right in the middle. Working in sales where, your appearance has to be on point, it did make me a little concerned with that I would have a giant scar going across my nose. But after seeing the work that Dr. Chen did, I have zero concern.
And so I was able to draw out a plan that I recommended as far as a reconstruction goes. I showed her in the mirror so that she knew exactly what I was going to do before we started numbing and before we started doing it.
They stitched it up, and I was like, how is this going to heal? Because it was literally a giant triangle across my nose, starting with the bridge. They grafted skin from the bridge of my nose to cover the hole in my nose, and then they stitched it in a triangular shape around my nose. Really, it is about the post-care. I put collagen powder in my coffee, smoothies, like anything I could think of, Vaseline. I literally followed the recommended post-op care very, very specifically, and it worked in my favor because I feel like I healed incredibly from that. It is pretty amazing to see how it ended up healing, and just the knowledge that they use and taking into consideration my bone structure, my facial structure, if there was to be scarring, which way like someone would look at you, and then, base that off of how they're actually going to stitch you up, I would say is pretty impressive. Dr. Eran Chen was lovely to work with. She was fantastic. I have recommended her. A lot of people that I have been in contact with are very pleased to see my nose. I know a lot of my family and friends were concerned about post-op and just the care that I was receiving, and everyone was pleasantly surprised, including myself, at the healing. I would highly recommend Dr. Chen and her staff. They have been amazing to work with. They're very knowledgeable. They make you feel at home. They answer any questions that you would have, and they're just lovely to work with. They are fantastic. I would recommend them to anyone.